Hello, Livingston, and welcome to our ongoing series of live programs here on Livingston Education. I'm Mike Raymer, and today we will open up a conversation on an important, challenging topic: mental health, depression, and suicide in teens. With me are mental health experts, Dr. Carrie Diamond, who is director of the Metro New York DBT Center, Dr. Beth Watson, who is a clinical psychologist, and Lucy Howell, who is a licensed clinical social worker. Welcome, Carrie, Beth, and Lucy. Thank you so much for being with us here today and for sharing your knowledge with our community.
Thank you, Mike.
Hi.
Hi, great to have you all here. For all watching, please participate by commenting and asking questions in the live stream, and our panelists will answer in a Q&A toward the end of the program. So let's begin with our three experts telling us about themselves. Carrie, would you like to start us off, please?
Sure. I want to say good evening to everyone. Thank you for having us. I'm Carrie Diamond. I've lived in the Livingston community now for about 18 years. I am the director of Metro New York DBT Center, practicing dialectical behavior therapy for individuals, groups, and families for the past 2 decades. Thank you.
Thanks, Carrie. Beth, tell us a little bit about yourself.
Sure. Thanks, Mike. First of all, thank you so much for having us all. I'm excited to talk about this topic and share some information about it. I'm a clinical psychologist. I've been working in the field of adolescent mental health for about 15 years. And I work with Carrie and Lucy at Metro doing DBT.
Terrific. Thank you. And Lucy.
Hi, I'm excited to be here. I'm Lucy Howell. I've worked with Metro for 6 years and have been practicing dialectical behavior therapy since, it's been about 9 years now. I know, Beth, your eyes just widened. You're like, wait, what? Yeah, for about 9 years. And I work with individual adults, teens, as well as families and couples.
Terrific. Again, thank you all, the three of you, for being with us here tonight. So Carrie, you have a slide presentation you wanted to start us off with, yeah?
Okay. So we're here tonight, Lucy, Beth, and I, to open up a discussion where we are intentionally talking about something that's challenging many of our teens: depression and suicide. This topic often is very challenging for families, schools, and a community to discuss. And so we wanted to take the time to start the conversation, see if we can share some facts, and then see if we can open up to questions and offer some ideas and answers to your questions. When we're talking about depression, it is our objective, the three of us, to share useful information so we can help our community better mobilize to support teens and their parents when they're struggling. We don't necessarily want to talk about specific therapy tonight, but actually to talk about the challenges that our teens might find themselves struggling with. It's very important to understand almost 13% of teens ages 10 to 17 experience an episode of depression during that period of time. In a recent study in the Journal of Pediatrics, 7.1% of children aged 3 to 17 were diagnosed with an anxiety disorder, and another 3.2% of children 3 to 17 years of age have been diagnosed with depression. Often, these two diagnoses can happen at the same time. If we can intervene during this period of time in an intentional, well thought out, empirically validated intervention, then we have a chance to decrease the chance that our teens develop struggles with substance abuse. We decrease the chance that our teens are struggling with school. We decrease family conflict, and we have an opportunity to intervene before there's destructive self-harm behavior or attempts of suicide. Without our interventions, it is likely that a teen who's struggling with depression will have a second and third episode, and some of these more complex behaviors will start to manifest. So it's important that we recognize that during this period of time, we have a real opportunity to make a difference. If not, adolescents are struggling. The second leading cause of death for children ages 10 to 35 years old, since it is the second leading cause of death, and since 1999, the suicide rates have risen in almost every state. And if we don't intervene, we are now seeing that suicide has become the 10th leading cause of death in adults. So it's important that as a community, as a family, as professionals, as teachers, that we pay attention to teens who are struggling. There's some facts here. I'm not going to go through all of them, but I want people to understand, according to our research, 17% of children seriously consider suicide. 14% are making a plan of how they might even act on that. And it's important to realize that 9.6% of these individuals are making attempts. Now, not everyone who thinks about suicide actually makes an attempt, and it's important to know that. However, those that do, almost 3%, will need medical attention. Now, there are some individuals in our community who are more vulnerable even than the average population. And so we want to pay attention. If you're coming with some gender identity issues, if you're struggling with academic issues, if you have a family of high conflict, or maybe even parents are also struggling with mental health issues, these are absolutely vulnerable factors that we want to pay attention to if we're going to start addressing depression. So from 2007 to 2018, there was a 57% increase. This is pre-pandemic. The suicide rate for girls ages 10 to 14 has tripled from 1999 to 2017. And we see that youth that are actually causing harm to their bodies or engage in self-harm behaviors have actually been to the emergency room in an increased rate. And these are kids 10 to 14 years old. So gang, we really want to pay attention to the emotional warning signs of depression. We're going to talk a little bit about cognitive warning signs, behavioral warning signs, and also emotional warning signs. I'm going to talk a little bit about this, and I'm going to hand it over to you, Luce. So if you're thinking, all right, so if my child is expressing some emotional changes, what do I want to keep my eye on? What are some warning signs here? I'm looking for feelings of sadness, including excessive crying spells. Maybe a child who is expressing increased frustration, a feeling of hopelessness. Maybe you're seeing an irritable mood. Maybe there's a low self-esteem and expressions of worthlessness. Lucy's going to talk a little bit more about some of the thoughts that are being expressed and behaviors to keep an eye on. And again, remember, this is not sadness. We're talking about depression. We're talking about a constellation of feelings, thoughts, and behaviors that we're concerned about. Go ahead, Luce.
Yeah, thanks, Carrie. So, one of the things I know I get really interested in, both in working with parents and working with teenagers, is actually like what is interfering with our ability to intervene, like you said, Carrie, even before there is a crisis. I think oftentimes we get adolescents, frankly, once there's already been a crisis. And so one of the questions we start to ask ourselves as a team is, okay, what do we need to be looking out for in the future so that this doesn't happen again? Okay. And some of the things that are super, super challenging with teenagers that as clinicians, we're always keeping a pulse on and is something that is definitely happening at home. So just to validate that you guys are probably doing the best you can with keeping an eye on your kids. And we also struggle from time to time. And we're, experts in this stuff. So teens, by design, they are secretive. It's a really normal thing for teens to start wanting some privacy. They want independence, they hide stuff, whatever it might be. It's not weird for a teen to want to hold on to private information. In fact, if they're being really transparent, we might go like, oh, what's that? What's that about? You're being really, really transparent about your life. What's going on? And, the other thing is that teens start to lie a little bit. It's either, the function of that can change from kid to kid, situation to situation, but, lying can sometimes protect some of their friends. It might protect some rebel behavior that they're engaging in. They don't want to get in trouble with parents at home or with school. Kids, they're isolating at home more and more. And we might talk a little bit more later about how the pandemic has sort of complicated the role of isolation. But it's really normal. Kids come home from school, they throw their backpack down. How was your day? Fine. Stomp upstairs, shut the door. Don't see you until the next morning. Stealing, right? Stealing is one of these things that's either happening at home. Kids steal their siblings' stuff. They steal their parents' whatever. They might be stealing a thing or two from different stores in the community. That happens. It's not such a strong sign, but as we're going to talk about in a little bit, there's a tipping point. There's a tipping point in these behaviors that we go from it being sort of normative teen stuff to then, what's going on here? Angry outbursts. I mean, we don't have to go through this one. We all know when, kids come home, bad grade, a teacher was, hurtful to some extent, whatever, peer stuff, social stuff, whatever, feelings of frustration, right? They come up and they can be in the context of biological changes, right, that are happening too with this particular age group. Increased substance use. It's like not weird, right? If teens are experimenting a little bit with smoking cigarettes or pot or drinking or whatever might be going on. But again, there's going to be a bit of a tipping point between the White Claw and the prom limo to, smoking pot daily at home before school or something like that, right? And then a decrease in academic performance. We want to be always keeping an eye on group of, where our kids typically tend to struggle at school. Like myself, I was not a math kid. So if I brought home a D, well, that wasn't so weird, right? But if all of a sudden, if my English grades were starting to tank, that would maybe be indicative of something going on, either with the teacher or maybe something even bigger happening, right? So, thanks for changing the slide. Well timed.
Thank you.
So as clinicians, this is something that we talk about often, and this is going to be, these are big words to be feeding to parents. So I'm going to break it down a little bit, but we bump into this issue of normalizing pathological behavior versus pathologizing normal behavior, right? So in other words, one side of this, what we're going to call a dialectic, is the idea of being like, that's normal. Like, that's okay. Smoking pot 7 days a week before school. Oh my God, who doesn't do that, right? I'm being dramatic, obviously. But then pathologizing normal behavior, right? Something like, well, you don't want to go to school today? Like, what's wrong with you? Kids don't want to go to school all the time. Pretty normal stuff, right? So one of the things I try to keep in mind in working with adolescents and talking to parents, try to think about it as two things. One, developmental or age appropriateness. So I'm going to use sort of a silly example, maybe two sort of silly examples. One might be, you've all probably potty trained your kids, right? Accidents happen when they're 2 and they're transitioning from one way of using the restroom to a new way. If that accident starts happening when they're 8, 10, 15, 25, hopefully you would get curious to go something like, something's up here, right? That would be like appropriate curiosity, appropriately pathologizing a behavior, right? Getting curious. A different way of also thinking about it would be something like taking the person into account. So my husband right now, he's in the living room, he's having a Lord of the Rings marathon. It's really normal for him. If that were me, I'd need a CAT scan. Like, that would be indicative that something's that is not my show. It's not my movie, right? So Lord of the Rings, it's not abnormal. It's not pathological. Him doing that makes total sense. If I'm stretched out on the couch watching Lord of the Rings on a Sunday, someone call someone. Okay. All right. So Beth, are you wanting to talk about barriers, or is this?
Yeah, I'm happy. I'm happy to jump in, whichever you think, Luce.
Sure. Well, why don't you go ahead, Beth? I didn't want to step on your toes.
Yeah, I can jump in. Yeah, sure.
Great.
The Lord of the Rings example is an amazing one. I really appreciate you sharing that. Yeah.
Thing. Never got into it. Or
So,
Harry Potter.
so one of the things that I want to kind of just bring to your attention is barriers to addressing teens' mental health. So right now, unfortunately, we are in a bit of a crisis with adolescent mental health, where there's a lot of need, and it's a challenging time. We want to try to figure out how to get support to everybody if possible, and be creative about ways that we can do that. One of the tougher phone calls that we get as a therapist is when we have a parent call and say, listen, I think my kid needs therapy, but they're not ready. They're not willing to come in. And so, we can't, that teen reluctance is understandable. It's something that we might want to work through. And if that is something that's coming up for you, you can maybe think about talking to other parents or other resources, and we'll have some other ideas later about other ways to get that kid some support. Overassuming skills is another thing that we notice that gets in the way of mental health. Thinking about, does my teen actually, are they appearing more healthy, competent than they actually might be? No, they've got this, they can handle this. This is fine. Kind of trying to be careful about overassuming and looking at what's actually happening. There sometimes is some judgment that comes along with addressing the mental health issues, some stigma, and we really tonight want to try to break that down, and particularly in this time period that we're in, to kind of understand that lots of people are struggling and it's okay. And so hoping that we can let go those judgments and have people just like open up questions and talk about these topics more. We put in here avoiding intense emotions. And so for some families and some individuals, it might be really challenging when an intense emotion is expressed. That might feel like a lot. That might be something that we want to just not engage with. One thing that we talk about a lot in our sessions with families, parents, and kids is that we want to accept emotion however it is, and we want to use that emotion. And so really thinking about helping individuals express emotions, even if it is in any way that works for them. There's definitely the point here, under practicing and asking for help. Sometimes teens don't know how to ask for help. They don't even know how to say, hey, I've been having these thoughts and I don't know how to express them, or these thoughts are coming up and I don't want to scare people by sharing them. So, that's something we notice as well. We want to just try to help people speak up in any way that they're comfortable doing so. We're definitely noticing right now in both the mental health field and with pediatricians that there's just long wait lists and clinicians are overwhelmed. And unfortunately, that may lead to, and even I'm thinking about like school staff, guidance counselors are feeling overwhelmed as well. And that might lead to individuals not being noticed. And so again, one of the things we want to try to point out today is how can other people in the community really come together and support our teens. And finances can be a barrier. And in terms of accessing mental health issues, and definitely something that we can find ways around, but can be challenging to work through. All right, Carrie. Oh, thank you. In terms of the cognitive barriers, there's a bunch of points here about how individuals might, kind of in our own heads with our own thoughts, say things, think things that will get in the way of them asking for help or trying to kind of get better. There's kind of a hopelessness that can come up. That is actually one of the symptoms of depression that will come up. I can't do anything for help. This is just how it is. I just have to accept it. And that gets in the way of someone trying to get better or change. Sometimes there is, an interpretation of emotional behaviors that the individual might be doing it to seek attention. And we want to be careful about making that assumption, especially if someone is sharing a lot of big emotions. We want to make sure we're trying to figure out what's actually going on there. So dramatic, attention seeking, kind of these phrases get thrown around. But I guess as a clinician trying to encourage the community to think about what's actually going on there, what's beneath that. It's just a phase. So this kind of goes back to that dialectical tension that Luce was talking about before, with kind of over pathologizing or under pathologizing. We know adolescents feel things really strongly. And we also know that adolescents are going to have big emotions, that emotions are going to really go up and down. That's absolutely normal. And that is a piece of normal development. At the same time, if you're noticing a lot of emotions happening, and like to Lucy's point about her husband's movie obsessions, it's really different for the kid. Your kid all of a sudden seems to be acting in a very different way than they act previously. And that's lasting. That's time that we want to really kind of pause and say something's off here. Let's see if we can get some help.
I think that point is really important, if you don't mind me stressing it. It's not just a change in behavior, it's a prolonged change.
Mm-hmm.
So all of us can fluctuate in our mood, in our thinking, and in our behaviors. The difference between having a difficult moment and experiencing depression is that those symptoms, behaviors, and thoughts are lasting for more than 2 weeks. And that's what we want to keep our eye on, is both the intensity and the duration of these symptoms.
So helpful, Carrie. Thank you. There is, when we talk about investing in therapy and addressing mental health through therapy, there is an investment of time. And, that's something to consider, but also, for those of us that do work within the field, we tend to think that if we can get in, Carrie's talking before about the timeline of addressing mental health issues. And we kind of think if we can get in there earlier on, the investment of time may not be that bad and change will happen. And so trying to figure out how that investment time is really absolutely worthwhile, particularly with kids. I mean, actually, one of the reasons I like working with adolescents, you can see really big change pretty quickly because they are still growing and developing, which is pretty amazing to see. Okay, so I wanted to kind of shift over to some good news. One of the things we get to talk about a lot in therapy is how to help teens feel better by increasing positive emotion. And so these are things that you guys know as parents, as anyone that interacts with kids, that the more that we all feel better when we can do things that help us be joyful, feel happy. I'm going to be a little specific here with a couple of different areas, and I want you to think a little bit about quarantine as well, because certainly some of these things have been impacted by quarantine differently, and they're appearing different than they were prior, and that is impacting our adolescents. So adolescents absolutely benefit from less screen time. As a clinician working with adolescents, I know it's really, really hard to control screen time. I do. And at the same time, we know when kids are spending a lot of time on screens, they are missing out on other activities. And so they're missing out on face-to-face interactions with friends, talking with friends, sports, whatever the other activities are, because the screen kind of takes that away. And so one thing we want to really think about is decreasing screen time in order to increase other activities. Social time is really important. I happen to be a parent whose family has been really careful about interacting with others because of, COVID-19 and the spread. So we're thinking a lot about social time outside. We're trying to think outside the box about how to get our kids engaging with other kids online, like Zoom movie nights. Social time is really key for teens. And so however you can get that to happen, we want to increase that possibility. A lot of kids felt better just going into school because of that social aspect of seeing friends within the school building. And so if you as a parent are worried about your kids' social time, I would think about what things can you kick up or increase, whether that's your own interactions, classes, extracurriculars, school, that's going to increase that social time. Extracurricular activities we know are really important. So many different arenas in which the kids can do different things. Sports, classes, clubs, volunteering. And so we know these things end up increasing positive emotion and helping these kids feel better. And so we really want to try to build as much in as we can. That doesn't mean to overwhelm your kid, but to really think about if you have a kid that's expressing some sadness or seems low, I would absolutely think, okay, what can we add in? Can we sign up for a class? Can we add in a sport, something? We know that physical movement is really beneficial. And this happens in lots of different ways for lots of people. As a therapist, we pretty much encourage them to do whatever works. YouTube exercise videos, Zumba class, rock wall climbing. I don't really care as long as the individual is moving. Family walks, think about how you can increase physical exercise. That will definitely lead to some more positive emotion. Getting outside. We know that just being in nature is helpful. There's actually a new therapy that's just kind of nature therapy about going outside more. And so really thinking about getting some fresh air, getting those kids out as much as you can. And creativity. And this is something that comes out in so many ways with our kids. So whether that's music, art, that might be cooking, like whatever that is, if you can find a way that your kid really is able to express some creativity and get into that flow, that can really, really positive as well. I am ready for the next slide. Oh, you already did it. Thank you. The other point that we really wanted to drive home is that we know that individuals are struggling with depression and suicidal thinking often feel isolated. And so that isolation comes from a lack of a sense of connection and a lack of a sense of community. So in order to be preventative, to try to help decrease those depressive thoughts, we can really increase social interaction. We can really increase a sense of community. So we're thinking about social interaction with peers, but this might also mean, interacting with people within the community, neighbors, synagogue, church, volunteering somewhere, having families get together, having people start to just interact more. I don't know about you guys, but I know for my family, we've been doing a lot of walking during quarantine. And like way back in the beginning, when we couldn't do much else, I remember thinking those walks were like the highlight of our days. Walking, seeing our neighbors outside, having people meet out in their yards and just chatting a little bit, just to have some interaction. We really also want to just kind of, when we think about our teens, think about increasing community support in general. So that might mean, as an adult, thinking about what teens am I interacting with, and can I just like make sure I say hi, how you doing, what's been going on, invest a few extra minutes, whether it's a neighbor, whether it's if you're a teacher, if you volunteer somewhere, just can you instill a little bit more of a positive connection with that kid? We know research shows us that that makes a difference for kids when they feel like they are connected, when they feel like they are seen. And the idea is that also will hopefully increase not only increase their positive emotion, but increase the chances if they are struggling that they will feel like they have someone they can tell. I wanted to talk for a minute about active listening. So when we say this term as a therapist, what we're talking about is really attending to the individual in front of us and thinking like hearing what they are saying. We know adolescents really benefit from being heard, from having someone really actively listen to them. Now, they're going to roadblock this as much as they can. AirPods in, screen in front of them, not offering those opportunities. I've had a lot of parents say that they intentionally will take their kids out on a drive just because during the drive, they know they get that good opportunity to really actively listen to what's going on with their teen. So I'm going to challenge you as parents to really think about what are your opportunities to listen to your kid. Are there times that you tend to do something? Maybe you're washing dishes and, during that time you tend to chat a little bit about your day, or, in the car. Or in the other opposite side, if you're in the middle of something and your team says, oh, I had a hard day, can you drop everything and just, pay attention, listen to what that kid is saying? We talk about validation a lot in therapy, and validation is really the idea of helping an individuals feel that their emotions are being heard. And so if my kid comes to me and said, oh, today was awful, school really stunk today, my validation, the way to validate my kid, my son, is going to be to say, sounds like it was a really rough day. It's not anything more than that. It's not rocket science, but validation is a really powerful tool for active listening and for individuals to feel heard. And like I said, we're just really trying to invest that time into listening, whether it's building in some time to do something together, creating it, grabbing any opportunity that you have, putting your phone down and attending to your kid and making sure that you are getting a sense of what's going on for them. We wanted to add in a slide here about being hopeful. And so the good news is there's actually a lot of, there are effective and evidence-based interventions that will help adolescents who are suicidal. DBT, which is a therapy that Lucy and Carrie and I do, has been shown, empirically shown, to be effective with this population. We directly address teen suicidal ideation, and we directly address self-harm in DBT. And it's a therapy that's done many practices. We are also starting to think about other ways to effectively address this issue. One of them is really thinking about burnout within the school and really thinking about ways to add some more support in the school for these kids. And I think a lot of the high schools in particular are really starting to think about this. Thinking about school mental health days or school wellness days, really starting conversations more about mental health within the schools and reducing the stigma about mental health issues. There's a lot of really incredible celebrities that have spoken up about their own struggles. And that's a really wonderful way for teens to feel understood and connected to.
Want me to talk a little bit about this for you to have a second to catch your breath? Or
Awesome. That'd be great.
Yeah.
Thanks.
Okay. So some of the ideas that have already been demonstrated to be helpful across the country include text messaging services for teens should they start to feel depressed and or suicidal. Finding email opportunities, even let's say through the Trevor Foundation, if people needed support, or suicide hotlines, crisis text lines, and being able to spend time talking with licensed counselors. These are all opportunities across the country where we can get free services or free interventions if you or your teen needs support. The question from our perspective is, where are we seeing this in our schools or on our websites or in our homes, right? If there's an emergency in our homes, should there be like poison issue, or you had a medical issue or a physical dilemma, I imagine you have emergency numbers somewhere in your home to address emergencies that come up. Beth, Lucy, and I are really in the business of also saying like, okay, where's your mental health crisis information? Do you have a National Suicide Prevention Lifeline somewhere in your kitchen? Are you someone who would show your teen like, hey, this is a website I understand can be really supportive. Maybe we could both take a look at it. Maybe you or another family member want to participate in something that is free. We really want to encourage people, if you're listening in because you're concerned currently about you or a family member, to think about the Family Connections program through the National Education Alliance for Borderline Personality Disorder. You'll find that at the bottom of the slide. There's also 2 organizations here for teens and adults who might want to learn more about finding a community who struggles. The Emotions Matter and NowMattersNow.org are great places to get started if you'd like to feel a sense of community. And we really want to encourage you to have connections, identify places that you or your teen might reach out if talking in the family is sometimes really challenging. If you're a teacher and you're doing the absolute best that you can, or a school nurse and you're just exhausted, these are other resources that we want to start thinking about as a way that you can feel supported and the students who you're concerned about can feel supported. We know in Livingston that we have committees getting started in the schools. We have teens that have clubs that have already initiated addressing mental health. There's a new tier system that the Board of Ed started to introduce, and we need so much more, maybe even before there's a crisis, so that the schools, families, and our community can feel optimistic and make a difference in how teens are struggling. I'm going to just stop sharing. We said a lot, and for us, this is Sunday. This is what we talk about 7 days a week, Mike, but certainly if the community or yourself had questions, I know Lucy, Beth, and I would be eager to pause and take some questions so that we could be more helpful.
Thank you so much, Carrie, Lucy, Beth. Staggering data here, important information. Thank you, enlightening our community. For all watching, please ask your questions in the live stream and we will ask the panelists toward the end. But we're going to open up a discussion here, a conversation based on the information and the topics that you are all talking about. And there are a number of things that are top of mind here, but wanted to ask you all, the three of you, as we move forward and we want to begin normalizing the conversation about mental health, why do you feel it's so difficult for many to talk about this topic and mental health overall? How can we raise the bar in that regard?
You know, I know that we talk a lot about this as a team, and often by the time the three of us are meeting families and their children, we're at a crisis. And I think part of what makes this hard is getting to a place where we're in a crisis situation. Things are hard to talk about at their peak. And so part of the problem is when these conversations are starting, it's our hardest moments. And I think part of why it ends up that we only meet people in a crisis might be fear, as we talked a little bit about, like, what's the point? Can someone really help me? I can't see this challenge I have, it's invisible. And so many people have doubt. Am I really having a hard time, or is this just normal? And I would say that most of the families who I've interacted with, and maybe Beth and Lucy, you have something to add also, feel some shame. Like, I'm really smart. I come from a great community or a wonderful family, or I had so much hope. And now I have a challenge that is so much harder than I thought it would be. And why can't I think my way to a solution? And that's not how mental health works. This is a brain-based challenge that we assume is being exacerbated by the hormonal changes and life stressors of all of our individuals and families. And we want to invite people to let go of their judgments, to start to get curious and pay attention. What's happening and how can we be curious together so you don't have to feel alone with something you can't see?
Great points, Carrie. And on that point, to start talking about being preemptive, right? So the question for the three of you, perhaps Beth or Lucy could address this. What is a good time to start thinking about or even addressing it with our kids? We're discussing teens here, but should we start thinking about it in pre-teen so it could be more preemptive? What are your thoughts on that?
Yeah, I think as a team, we err on the side of trying to think about how to not ever get to crisis phase, right? Like Carrie's saying that we're often addressing the acute behavior or emotion, like in our kind of our worst moment. It can be really, really hard and really straining for families. But I think even sort of commenting, Beth, on what you were talking about earlier around active listening, I feel like our adolescents start to learn the cognitive patterns of like, well, hold on, like I have a good friend group. I'm not actually struggling, right? They learn some of that language to talk to themselves in their heads because that's how the community is talking to them, you know, at large, like either at school or at home. Like one of the things that the vulnerability factors for parents, like who are worried about their kids all the time, good days, bad days, there's always a looming sense of like, are they good? Right? Is if a kid comes home and says like, everyone hates me, I suck at school, I'm never gonna get into college, or I'm never gonna make it on the basketball team, whatever it might be, the inclination, because you're wanting to fact check your kid, is to say, well, hold on a minute, you've got great friends, you're invited to this birthday party this weekend, you're about to get your driver's license, like, what do you mean everyone hates you? Right. And so that's now language that teens have in their heads. Like when they start to have that feeling, they counter it with another thought of like, wait, right? So it actually kind of closes them off from asking for help or talking about it. And it's so frustrating because it's so well intended from the community, whether from the teachers, parents, whoever, right, to want to address each and every complaint from the kid. But to Beth's point, we want to actually err on the side of like, sounds like today was a really bad day. What happened? Or like, hold on a minute. What do you mean everyone hates you? What went on today? And then you're going to get AirPods and a door slam, but you haven't said, no one hates you. I don't hate you. Right. It's like, doubling down. So there's no rule on when to talk about these things. It's like anything else that's complicated or complex or mature that you talk about with your teen. There's not like the moment, the age, right? But it starts with normalizing emotional experience, right? Normalizing that everyone has ups and downs, and also normalizing asking for help when you're in distress. Just like Carrie, to your point, you would ask for help if there was a medical thing, right? Kids are actually really, really effective, really skilled at when they get hurt, they go to the nurse, right? They go to parents, they go to whoever for whatever it might be.
Great points.
I'd love to jump in if I can, Mike.
Absolutely.
Okay. So, you are asking about like developmentally, when is this topic appropriate? I'm thinking a little bit about, my own kids as well as my work as a psychologist. One of the things that we really try to help parents think about developmentally is, are kids taking care of themselves? And depending on the age of the kid, are the parents setting limits in terms of these self-care things? So like one of the things that we talk about every single time I do an intake, I'm sure Lucy and Carrie do this too. Are you getting enough sleep? Is your kid eating 3 meals a day and a varied kind of foods? Are they getting enough food in? Are they getting some exercise? And these are things that will like end up leading to a kid potentially being in a rough or emotional place. And so we want to pay attention to those things. And then as a kid is getting old enough, I'm thinking like, I have a 10-year-old and I will say to her, you seem like you might be hungry. Do we need to take a moment and have something to eat? I can tell there's a lot of stuff going on right now. You haven't eaten breakfast, can we pause? Can we get it? And so we're teaching those self-care skills even early on and adding them in as they get older.
Great points. And on that point, listening to you all, of course, active listening, Lucy mentioned, and getting to what you just mentioned, Beth, on limits. Parenting is tough stuff, right? And we've been hit with a double whammy, this pandemic, and then of course, social media, the rise of the iPhones that our kids contend with. So if you could, Beth, back to you, or Carrie or Lucy, talk to, and I can imagine this is multi-hour conversation, but how to perhaps set limits on the phone or social media. What are your quick thoughts on that?
So there's not hard and fast rules about this, but I do think thinking about limits as a parent is incredibly important, especially when you think about it in the context of everything else we're talking about. So when we have a kid that starts to be presenting differently, acting differently, exhibiting different behaviors, or not seeming to be as happy, is part of that a need for more limits around screen time, social media exposure, right? And so, we really ask a lot of questions in therapy, and I would encourage parents who are listening to ask a lot of questions as well. Is this kid on the phone? What are those things? There's no hard and fast rules. Some kids are going to use things differently than others, but like, what are the impact of those things on your kid?
Okay. Very good. Anyone also feel free to jump in. And again, those who are watching, please ask your questions in the live stream and we'll pick it up toward the end in a Q&A. Some other questions top of mind for you. I noticed in the statistics, and it's been published, it seems to be that girls, the rates are much higher. Why do you think that's so?
I think it's a great question that we don't have an answer to. I think part of it stems from more and more of the selfie generation, right? So a great resource, by the way, a book, if people are interested, to start to think about when we're in pain, all human beings, when we're struggling with pain of any kind, we get very self-focused. And when people are struggling with depression or thoughts of self-harm and suicide, their thoughts are often very much about themselves and how can I get relief from pain?
Mm.
If we are raising a generation who is looking on Instagram, Snapchatting, on social media, and over-focused on the I, we're laying the groundwork. Our neural network is ready to go. That as we're having intense emotionality, as we're depicting perfectionistic standards for particularly adolescent girls, we're seeing them struggle as they increase their time on social media. We see depression rates and self-harm rates also increase.
Mm.
And so there is a high correlation. Girls who are on social media, and we see this in the news now on Facebook or Instagram, right? We are beginning to see the impact on our girls and their moods, their impulsivity, their inability to think globally, to take a step back and be able to self-regulate. And so part of the question that you answered before is how young to start talking about this. Well, we hope that we're not talking about necessarily suicide and depression in young ages, but what we're talking about is how are you taking care of yourself? How are you learning to reduce the chance that you get depressed? And also, if you get overwhelmed because of social media, because of the isolation, how are you going to teach your children how to tolerate uncomfortable so that they can find the strength to tolerate the uncomfortable until it becomes comfortable? And that's something that all of our kids are quite challenged with.
Makes sense. Makes sense. We have a number of comments and questions coming in the live stream. Michelle Siskin-Pearl made an interesting comment. And this comes back to the pandemic, right? Kids have essentially lost 2 years of their lives. So there are definitely more challenges now, right? And she also raised the question, do you think there might be a need for more counselors in the schools? I can, again, imagine the complexity of that, but and Michelle didn't necessarily ask this, but it's been on the mind of many. Should school counselors be involved in that type of counseling or coaching? They're on the front lines, right? They can see that. What are your thoughts on that? Counselors being involved, and should there be more?
So I know across the country, there's been an investment in supporting schools who counselors are on the front line, nurses who are on the front lines dealing with this mental health crisis. I think the question isn't just about more, but about specifically trained to address these issues. The three of us come from a type of treatment that assumes everyone's doing the best that they can. I cannot stress that enough. And so I'm sure that the school counselors in our community are doing the best that they can. There's probably not enough shoulders.
Yeah.
And also we worry about the types of assessments and expertise that are being offered to our schools. And so I know our colleague, Alec Miller, is attempting to bring some of these skills preventatively, these distress tolerance skills, these mindfulness skills into schools in the New York, New Jersey area, so that before we have an epidemic, before we have a problem, we can actually help our elementary school and our middle school counselors and students feel more empowered to navigate these very concerning issues. So on the one hand, of course, more, but also more with evidence-based interventions that would make a difference.
Beth, Lucy, do you have thoughts on that in terms of school counselors and how they might be trained?
I agree. I was actually, as Carrie was talking, I was thinking about my own high school experience, my own middle school experience, and actually thinking about how we were so rehearsed in how to manage things like drugs and alcohol. Like there was so much for sort of lack of better terminology, like role play around how to be effective in the face of substances. And it just sort of got me curious about like what has been interfering, just frankly, just sort of coming back to kind of like the point of why we're all here tonight. What has been interfering with doing the same thing in the context of emotions or, other behavior? And I agree, right? Just to emphasize Carrie's point that, for the folks who are working with our students in schools, it would be super important that, or I guess it's my opinion that it would be really important that, you know, they be trained in a way so that we are helping to empower autonomy in students and not reinforce dependence in an unhealthy way.
Good points. And back through the times that we're living through here, of course, the pandemic, will we ever go back to times from which we have come? We don't know. Question is, and you all touched on this, but just to review it, and then what else, how has it changed and how should we work with it and handle it? Of course, the pandemic has exacerbated this, right? With teens. And you all touched on isolation, right? And you did talk about some solutions, which I think were great. I think Beth touched on a number of solutions. What in an isolated world, and hopefully it will end soon, but what can we do more as parents and also from the schools? How can we assist our students to help manage the isolation? Beth, I think you mentioned activity, right? Activity and being part of sports teams. That makes sense, I would think. Huh?
Yeah, I think encouraging any kind of activity or any kind of community connection. One thing I would just really encourage parents to think about though is like it doesn't necessarily have to be the sports team. It doesn't have to be, you know, a structured art class. It might be, you know, connecting with extended family, helping out a neighbor, just kind of trying to increase connection in general. I do think that's really, you know, unfortunately it's a little bit tough right now. So parents have to be creative. What works, you know?
Yeah. You see your child on their phones, and we all do, right? For hours at a time. Makes sense to intervene. Not an easy thing to do for a teenager.
It's a challenging thing. Oh, absolutely. I guess the other thing that I would think about, that I think about a lot myself as a parent when I'm seeing that, is like, okay, you know, what activity can we do? I mean, right now it's February. It's like probably the hardest time of year and is in this area where we can't get outside a lot, but like, you know, people are making bread, people are cooking, can you make dinner? Like, are there, you know, puzzles? Like, are there family engagement activities that might help the adolescent, the kid engage and put the phone down for a little bit?
Yeah, very good. Here's a comment from Fal Pandya. Interesting. Parents, schools, and mental health professionals are first line of defense. But what can we do as a society? That's a big picture, right? What can we do as a society? What kind of environment and events or buddy sharing, if I'm getting buddyship, can we create to support our teens and their families? What you were alluding to there, right? They're creating what you were, I think, right, Beth? Is there, and also.
Yeah, I mean, yeah, you guys feel free to jump in, but like for me, I mean, I think about my family friends that have, you know, teens that have been going through this and probably hit hard. And I like try to spend a few minutes checking in with them and ask them questions, you know, like, and I hope everybody can do that a bit more.
Mm-hmm. Very
I
good.
think there's also ways that we're seeing business owners offer positions of either employment or internships or opportunities to volunteer in the community so that you know the person you drive by, you know a person when you're at the supermarket. And I would strongly encourage people, these are adult ideas. The best thing we could do is start talking to the kids themselves and saying, if you were going to improve this muscle, how would you do it? And that's what I love about some of the clubs that we have in our area. Certainly Maplewood's offering different ideas, also coming directly from adolescents in the schools themselves.
Mhm.
So we want to start asking our families, our family members, what would help you feel more connected? What would you be interested in?
Very good. Some really great comments and questions coming in. And all three of you, of course, after you'll see the questions. And here's one from Soma Chandori. Very lengthy and complex and wonderful thinking here. I'm going to paraphrase. Wellness and mental health care in school needs to be intrinsic and not necessarily 2 days or reactive counseling? How can this be ingrained in the interaction with teachers? And she said there are 3 pillars that need to be looked at holistically in tandem. What are your thoughts on that? And I know we have such wonderful teachers in Livingston, just amazing at all levels. We're blessed. And I know probably many of the teachers are very mindful of this, but what are your thoughts on ingraining more of mental health, necessary activities, but thinking into their teaching?
I think this is a great question that certainly we don't have the specific expertise in commenting on. However, what we talk about as a program is how can we, on a daily basis, as clinicians and for our clients, be thinking about increasing mindful attention, learning strategies to tolerate distress, regulating emotion, and being a capable person in interpersonal relationships. And I know that many school systems, including ours, are trying to have social and emotional education. And the more I think that the evidence shows that mindful attention, tolerating distress, regulating emotion skills, and being a community member where we practice communication skills, the more we can do that from the get-go, the more likely we have a chance of decreasing these rates that are showing up so regularly.
Oh, but it's funny, right? Is that like when we work with adolescents and they're doing DBT skills with us, is they will often say something like, gosh, like they should be teaching this in schools, right? And my gosh, they already are packed to the brim with their schedules. Like, where would we find the time? But it's a really good point. So like what you were saying, Carrie, if we were gonna actually ask kids and teens, like, how would you improve on this muscle, right? Maybe one of the things they're saying is like, hey, this would be really helpful if this was like my 3rd period in my day, right?
Exactly.
Again, thank you all watching, and your comments and your questions are excellent. A lot coming in. We'll try to cover as many as we can. Here's a question from Jason Shapiro. Do you think schools should teach a, quote, formalized suicide prevention safety plan so children know what to do if they have feelings of self-harm? Tough one,
Anybody want to field that? I think it's a great question from Jason.
Yeah,
Right.
it's tough, right? Because there's not a one size fits all. I mean, that's as clinicians doing DBT. I mean, a lot of what we do is present skills and then help individuals figure out what works for them. And I'm kind of trying to think about how to fit that in a course, and it would be hard. I think from my perspective, what would be helpful is what we have been talking about, introducing some of these skills, mindfulness, distress tolerance for kids in general, versus kind of honing on just the self-harm piece.
And that in
I don't know,
our
what do you
tier
guys think?
system, one of the things that we could think about is a team who's identified for proper screening of a child who is either reported by peers or reports themselves as someone who we are concerned about, who may be at risk for self-harm, might be engaging and at risk for suicide. Some of our neighboring towns have a team devoted to that. So amongst their tier system, there is someone who's trained to assess and then to intervene if they have an identified student, and then to increase frequency of contact. I can't speak to whether or not Livingston has thought about this yet, but certainly having a team that's trained and devoted to high-risk teens in the school system probably makes a lot of sense. And what we've been focusing on is what to do earlier in the chain of events.
Yes. Again, excellent questions coming in. Thank you all. Question from Sakira Bagat. I apologize if I'm pronouncing your name incorrectly. She's making a comment here. If there is a time post-pandemic when counselors are overworked, interesting, post-pandemic, can we look at introducing monthly or more frequent mental health type of education or training? I know this might be beyond the three of you. But it's interesting. This brings me back to, in our generation, we grew up, health class was much focused on the physical, right? And in today's day and going forward, wouldn't you all agree? It should be equally balanced, right? Both physical health and mental health. And wouldn't it be wonderful that health class one day soon is focused on the both mental, the physical and the mental, right? Do you know of school districts that do that, or is that something that the three of you foresee? What are your thoughts?
There are two groups in our specialty who are working on this. There's a group who teaches what's called DBTA or DBTA adolescents on the West Coast. It's a two-party business that goes into different school systems, both on the West Coast and the Southeast in the United States, and teaches different districts certain strategies to increase mental health. And then there's our colleague, Alec Miller, out of Westchester, who is also bringing curriculum to, I think now he's in 75 different schools in the New York, New Jersey area, introducing this DBT model of mindfulness, distress tolerance, emotion regulation in health systems, but also training up staff so they can implement some of the interventions that Lucy and Beth were talking about tonight.
Fantastic. Here's Alana Kipnis. Thank you, Alana, for your comment and question. She says, hi, guys.
Hi.
Yeah, she wanted to let us know that she is starting a parent forum focused on mental health. And so if parents wanted to reach out to her, she's starting that. I believe it may be a Facebook group or something similar. So thanks for letting us know that, Alana. Another question. I know that our topic here is focused on, at this point, depression and suicide, but there was another asked earlier. I just want to get her name. She asked, how do you go about, here is Debbie Minsky. Thank you, Debbie. What are your recommendations for finding a therapist? How should someone go about doing that?
You wanna
Call one of
start,
us.
Beth?
Call one of us and we'll help you find someone. It's a hard time because a lot of therapists are booked. But one of the things I really adore about Carrie is that no matter how busy she is, if someone calls our practice, she will take time with that individual to help them think about who they could work with. And so I hope it's okay that I'm volunteering you, Carrie, but I'm willing to do it as well, like help you find someone.
Fantastic. And as you mentioned from the beginning, I can only imagine with the demand is so high, right? For children, adolescents, and adults. Yeah.
I think it's important.
Hi, right? Like, I think one of the things that we're starting to notice as clinicians, as the world kind of, become a bit out of our quarantine pods and stuff, is that we want kids in their activities, as we've been saying this whole time, like be in a school play, do basketball, and at the same time come to treatment twice a week. Like the two don't actually go together sometimes, right? So we're sort of constantly towing this line between helping our adolescents stay in treatment, reach out for help, and be involved with us or whoever, right? Like as needed and as recommended. But we are bumping into a little bit of a dilemma from time to time when it's like, oh my gosh, like my sports team is going to start practicing now 5 days a week, right? We're like, oh my gosh, this is the thing that we've been wanting you to do for so long, but oh my goodness, we really need for you to stay in treatment and keep working on this stuff with us. Yeah. So yeah, it's a good problem to have in that regard.
I think that if Debbie's looking for people how do you find help? Start with connections you have to begin with. Speak to your pediatricians. If it's not your pediatrician, talk to your clergy member. If it's not your clergy member group, then I'm going to encourage you to talk to someone in the community who might do this for a living. Depression, issues of self-harm and suicide, it's been demonstrated that behavioral treatment is the most impactful at this age, not perfect, but impactful. And so if you know someone who specializes in behavioral treatment, ask them, who would you recommend? This is my kid. This is my family. We are always happy as members of the community to answer these questions. And if it's not us, there are other people. There are parents with expertise. There are your pediatricians, your medical providers, your friends. Ask a stranger. If you know someone who's already in treatment and it's helping, don't be shy. Say something, right? Be a community member to your peers.
And Carrie, I would just add the school as well. The school
Yeah,
will have those.
absolutely.
Absolutely. So thank you all. We have a few more minutes as we come toward the end. There's a few more questions coming in, but again, I wanted to thank you for your time and your knowledge and sharing with our community. So helpful. But here's one that in doing what we're doing tonight, I won't necessarily say groundbreaking, but it is leading edge in opening up this conversation on a real tough, challenging topic. And I admire you all for helping doing this. But what might you say to those that could be potentially a double-edged sword, right? In discussing these topics, weighty topics about depression, about suicide, are we planting the seeds in our kids' minds, potentially for them to, well, let me Google it, let me find out more. And so I don't feel that way, but what do you say to those that might, planting the seed? As we try to normalize this conversation, right? What do you think, Carrie?
I think it's a very typical fear. And so I want to say, I understand. Had I not been trained to address these issues, I'd be scared too.
Mm.
And the reality is, if our children are thinking about their mood dropping, their sense of worthlessness, they're thinking nobody can help, this is a secret to keep, and the only answer is self-harm or risking their lives, they're doing it on their own. They're all by themselves in this challenge. And so I say to everyone, don't leave your kids alone. This is hard as it is as a community. Start talking. Start asking questions. Let go of your fears, lean right in and just say, like, we're going to put this out on the table and together we're going to try and figure this out. With support, with ideas, with resources, with conversations. Open the conversation. Keep talking. Ask for help. Do it together. Don't leave your teen by themselves in this very overwhelming state. The seed's already there.
Yeah, and on that note and that point, and we addressed it a bit earlier, but I wanted to get the three of you, your thoughts on what can our schools do more of? What can they do? To me, this is a parent, at home schools partnership. So a tragedy won't happen in our community, right? But what can our schools do? You mentioned some good things. I think it was Beth. I think Beth mentioned, the clubs that are starting up, right? There's one in the middle school in Heritage. It's wonderful to hear that, right? What more do you think? What about depression screening? Is that you're shaking your heads? Would that might work? What other ideas that you might have for our schools?
I think our schools are doing quite a lot at the moment. I think that we need to come up with a comprehensive plan that enables them to screen, be trained, and have the hours devoted to the areas of concern. I think the parent interaction that's already starting is a great next step. I think what Alana Kipnis was mentioning about parents coming together, talking about mental health, we can't over rely on the schools to solve a problem that they don't have enough staff or training to accomplish by themselves. So I think it's about getting everyone at every level to have some type of next step. So clubs that address mental health, parents that address mental health, schools that have proper training and assessment, and perhaps a team that specializes in addressing these issues if it doesn't already exist.
Great summary, Carrie. Excellent. And as we wrap up here, I wanted to ask any last thoughts, comments, words of wisdom? Carrie, those were words of wisdom, what you just said. Beth, Lucy, any last thoughts on mental health and or the specific topic, suicide and depression?
I just wanted to say thank you for the community members that decided to join us tonight, because that in itself is what we're asking you to do, which is kind of learn more, be aware, contribute some time to this issue. And so we really appreciate it. Thank you. And thank you, Mike.
Thank you.
Yeah, just to echo what Beth said, thank you so much for participating, because, right, Beth, like the big behaviors that I think we're asking for from schools, from parents, right, is to participate and to be transparent. And so as we're opening these conversations, like, yeah, there's the content about what we're actually talking about, but then there's like just sort of the bigger picture of practicing openness and transparency. And that's something that we actually really need from our adolescents, right, in order to help them when they do need help.
Agreed. Very good. Thank you all again so much. Have a wonderful evening. We'll say goodbye for now. And if I could ever be a conduit in any way, always happy to help. So
Thank you so much for having us.
Thank you.
Thank you. And thank you everyone for watching and participating. Greatly, greatly appreciate it. All right. Good night.
Good night.